You're listening to Stretch Unscripted,
the podcast where we stretch your mind,
flex your curiosity,
and keep it completely unscripted.
We'd like to thank our sponsors, Intelligent Community Initiative, Blue Cross and Blue Shield of Oklahoma, and Catalyst Co-working.
Hello. You're joining us in Stretched Unscripted, and I'm your host, Roger Kollock, and I am joined here with Carolina Mars, our guest for today. Would like to just kind of give a big shout out to our sponsors, Blue Cross and Blue Shield of Oklahoma, Intelligent Community Initiatives, and also Catalyst Co-working, or we're actually filming this podcast today. If you're ever on 15th and Lewis, please stop by Catalyst Co-working. They also have a really nice coffee shop downstairs. The coffee shop is Bryce's Coffee Shop. So come on in, stop by, get a cup of coffee, and get some work done. So, as I said, our guest for today is Carolina Morrison. And Catalina, thank you so much for coming on our podcast today.
Yeah, thanks for having me.
So, Carolina, I think we probably met when maybe it was, oh goodness, I'm taking like maybe 6 or 7 years ago, something like that.
It was 2021, 22, something like that. Because it was when we decided to have the first Black Men in White Coat Summit, and we did it at TEU.
Yeah, okay.
And it was in 2022, so we had to have started planning it in 21. So.
Yeah. So it's been a while. I couldn't remember if we had started doing some things together before COVID or after COVID. Things kind of get to be a little bit, you'll blur with that. So, well, you got a very interesting story. I know you wear a couple different hats, and we're kind of going to get into that a little bit. Your work that you do with YMM, we'll kind of touch on. Obviously, want to talk to you a lot about what you do for Hillcrest.
Yeah.
What your role is there. I think that's probably a little different than as far as what some of our guests may see as a particular career path in healthcare. So definitely you want to kind of touch on that a little bit as well. So as we kind of look at things, why don't we start from the very, very beginning? And I like to kind of like people to kind of just start off from like, what was life like just kind of growing up? Did you have just an interest in healthcare growing up, or was that something you developed like later on in life? Just kind of walk us through that just a little bit.
Yeah, so I grew up in California and had a pretty good childhood. I had 3 siblings. My parents are immigrants, so we were kind of like just navigating life all together, and everything was new to my parents. So, and I think like every other kid, I was like, oh, I want to be a doctor. Like every kid says, I want to be a doctor. I want to be a firefighter. And I remember I think it was the 3rd or 4th grade, I wrote a letter to the president, and I think at the time it was Bush, the older Bush, obviously. And I said I wanted to be the first kid in space. So that was like my first start into like thinking about, ooh, what do I want to do, right? So I was dreaming big. Anyway, so as I went through my school career, whatever, school pathway, it wasn't until I got into high school where they had a medical magnet program, and we actually got to do clinical rotations at the local hospital. And this was, 30, I'm not going to age myself, but 30 plus years ago. And there wasn't as many rules and regulations as there are today. So I remember like just being in the surgery room with the doctors, and they were like, ooh, do you want to touch this or touch that? And I'm like, oh my gosh, this is so crazy. And so that was really my first taste of like the healthcare field. So fast forward to when I graduated high school, I went to college. I was a college athlete. And let me back up. So my parents couldn't afford college. We were like, whatever happened, you got to just figure it out, get loans, do whatever. So I ended up getting a full ride athletic scholarship. And so that was kind of my ticket out. And so when I got to school, I was like, okay, I think I really want to pursue this doctor thing. So, I signed up for all my classes, and the first chemistry and biology classes, I was like, this is not for me. But I knew I still really liked the healthcare field. And so I just started looking at the catalog, like what other career paths or, what interests me, what's still in the field of healthcare, but not like clinical, right? And so I landed on health education. And so I thought, well, I could help people, stay healthy and stay out of the hospital and stay out of, being in those sick situations. And so I ended up getting my master's degree in community health education. So I knew I didn't want to be a teacher, but like a teacher in the classroom, but I wanted to help educate the community. And so I kind of went the public health route.
Okay. So you kind of touched on something there. I kind of want to go back to. So you did your undergrad at University of New Mexico?
Yes.
Correct?
Correct. Yeah.
So I thought I remember I was talking about this. So you ran track for them.
Yeah.
And so, most of our viewers and listeners, they can, they know if they follow college athletics, that's a Division I school, right? And so that's Division I athletics. So you were a Division I track athlete. Okay. So that takes up a lot of time.
Yes.
Okay, a whole lot of time.
Oh, yeah.
And so can you talk a little bit about that? What was that like? Just kind of, because I think our viewers want to know that, because some of our viewers, they have a lot of, they want to go to college. They also know that there's some other things that they really want to pursue in addition. And some of them are athletes and wanting to say, hey, am I going to be able to kind of balance being, a college athlete with my academics? What does that even look like?
Yeah.
So can you speak to that a little bit?
Yeah, I mean, I think a lot of it had to do with having really good relationships with your counselors and advisors. And student athletes know this. When you're on scholarship, you're basically married to that athletic team for your 4 years or whatever it is when you're in school. And so I knew what time practice was every day. And so really just looking at the class schedule, finding everything that could fit within that time frame. But the other thing that I think really helped me get the experience I needed was, I was a poor college kid and I needed a job. And so I found a job at the student health center on campus. And so that was kind of the perfect blend of, having a job on campus, making a little bit of money, but still kind of being in the field that I thought I wanted to go into. So really just taking advantage of the opportunities that there are, colleges have, so many opportunities and just things to help students. So really just balancing it. And it's so cliche to say, right? Like, it's easy, just balance it. But if you'll make it happen. If you want to do it, you'll make it happen.
Okay. So I want to kind of shift gears just a little bit and kind of talk. Did you talk maybe a little bit about what you do with Hillcrest? And just kind of go into that. Because again, it's slightly different from, that kind of like when we think about like how people can like contribute to healthcare and things that they can do. The first thing most folks think of is like, well, I need to be some type of like practitioner or clinician. Yours is a little bit different, like you said, with your educational background and stuff like that. And so, so you are the director of business and governmental relations for Hillcrest.
Yeah.
So that sounds really important. Okay. So unpack that for us and tell us what that is all about and what your day-to-day is like with that.
Yeah. How much time do we have? I've been with Hillcrest for, 15 years now. And so, my role has definitely evolved over the years. So gosh, where do I start? So I do a little bit of everything. I mean, every day is different. So, and that's why I love my job. Every day is like, this is what I'm doing today for my job. This is awesome, right? But the way I describe my job is anything I can do outside of our hospitals and clinics to help people understand the healthcare system, I'm going to do it. So if it means attending a health fair at a, college and career fair, or at the high school level, or partnering with employer groups around town and bringing physicians on site to do lunch and learn talks. So anything to educate people outside of our health system is what I do. And I don't want to say there's not really a limitation. If it makes sense, I mean, my leadership team is like, go for it, right? A lot of it is marketing. A lot of it is community relations, right? So developing relationships with nonprofits in town, or just other organizations that can, we can work together and maybe partner on something. The government part, the government relations part, was a new ad. So about a year and a half ago, before our previous CEO and president retired, he thought, I need to pull someone into this role to kind of nurture these relationships with, the Senate, all the people that are in the government aspect side of things. And so he held all those relationships, but he could foresee that, his retirement was coming. So he brought me on board to take on some of those relationships. And so when that started, what that looked like was really just tagging along with him and going to a bunch of meetings and shaking hands and just letting people know that I am the face of Hillcrest at these meetings and such. So after about, 6 months or so of doing that with him, he felt comfortable enough to kind of let me go on my own. And so that's been a very interesting piece, because I don't have a political background at all. And so it's been interesting kind of learning how that whole part of it works. So yeah, there's a lot to learn there still, but I think it's a great way to kind of, someone that's looking to seek a career maybe in the political side, there's still a way to do, politics and medicine or healthcare. So.
Okay. So I kind of want to continue down that track, and it seems like, again, that seems like a really big role. It seems like you're interacting with, folks on a lot of different levels. And so, what are some of the things you feel like have prepared you for that? Helped you to develop, your approach to, leadership and advocacy and things of that nature?
Gosh, I think for me, it's been having really great mentors along the way. I've been fortunate enough to have really great bosses. I mean, I can't think of one, everyone says, oh, I really hated working for that one person. I can't think of anyone that I could say anything negative about. It's just that the mentorship, the trust, I had the thirst and the hunger to want to learn. I don't want to say always been okay, but been okay with being in uncomfortable situations, because that's the only time you learn something new about yourself. So a lot of times just kind of being thrown into new things, and the fun part is figuring out a solution, right? And there's no right or wrong answer, but figuring out your way to do it. So I think, I would say mentors has been one of the biggest things that has helped me shape who I am as a leader and as a person in the community trying to make positive change.
Okay. So when we look at healthcare organizations, public policy and community needs, what do you think, just from your perspective, what needs to be done to kind of bridge the gap between those three things?
Yeah. So I had this conversation with someone at the city of Tulsa, and I took it back to like the 20,000-foot view. So I was like, just looking around the community, I feel like there's so many resources we have here in Tulsa and in the state. But I feel like every day, every week, I'm learning about some new organization or somebody that's doing something great in the community. I'm like, I've never heard of this before. And so what I shared with this person at the city was it would be so awesome if we had like a directory, and maybe this does exist and I don't even know about it, but a directory of every resource that's available in the community to students. And this conversation was more about like, students and how do they learn about like scholarship opportunities or things that, we have a junior volunteer program. How do students learn about those things? Well, the other hospital systems have the same type of programs, but it's a lot of work to tell a student, go to the St. Francis website, go to the Hillcrest website, go to the St. John website. It would just be awesome to have one single resource page, right, that had hyperlinks to Hillcrest, St. Francis, St. John. And you could click there and then it would take you to that page or whatever that looks like. But there's just so much that the community has to offer, but I just think we don't know about it.
Okay. So kind of on the same lines, just kind of talking about those three components, what are some of the common like misconceptions people may have when it comes to the intersection of healthcare, government, and community?
So I think one of the biggest misconceptions is that people think that they're all separate kind of entities. And, we all watch the news and sometimes it does feel like that they are separate and maybe butting heads or working against each other. But I feel like when the three are working in sync together, that's when we get the most bang for our buck. That's when we get the most, positive health outcomes and changes that benefit the community.
Okay. So I know, that already sounds like everything you're doing right now. It just sounds like it keeps you like super, super busy.
Yeah.
But I know you do somehow in your life and schedule, right? You find time to do other things. And I know one of the things that you do, kind of outside of your job at Hillcrest is your work with YMM, Youth Medical Mentorship.
Yeah.
And so, I'd like for you, if you could, just kind of maybe talk about that a little bit today. And also, talk a little bit about maybe some of the upcoming events that you have, because I know you have the big gala coming up, and just kind of tell us about that piece. But first, kind of tell us about kind of what you do for them.
Yeah, so for Youth Medical Mentorship, I serve as board chair currently. I started with the organization from literally when it was just an idea on a napkin. So, Dr. McNeil, he loves to have these grand ideas. And so, so that was about, 4 years ago, maybe. And so it has just evolved and taken off faster than we can even keep up with. And so it's so fun being part of an organization where you can actually see the change. You can work with the kid. You're not just dishing out a bunch of money and hope that it goes to the right organization, doing what they say they're going to do. Like YMM is actually doing the things they say they're going to do. And we see that. And the nice thing about working for a healthcare organization is YMM, their mission fits perfectly with any healthcare system's mission and vision and, what we need for the future. So I remember when I first started kind of getting more heavily involved with YMM, I talked to our leadership team and I said, in 10 years, if we don't have a pipeline of like doctors, physicians, biomed, radiology techs, you name it, we're going to have to close every hospital door, in this community, in the state, in the country. And so it makes sense to partner with an organization like YMM who's building that pipeline for students to eventually come work for us one day. So it's just been, it's been a really great ride with YMM.
Awesome. So I know one of the things that YMM kind of stresses is like mentoring. And so how have, like, I know you kind of talked a little bit about like some mentors that you may have had, like kind of while you were like in your career, things like that. But tell us about the importance of like mentoring when you're young, like when you're young and you're still trying to figure things out. How is it helpful for you to have like a mentor or even like seek out a mentor? And so can you speak to that just a little bit?
Yeah. And I think that's why I'm so passionate about YMM and just being in the role that I am, because I have the opportunity to give back as a mentor. Because that's one of the things, I mean, I've learned so much from my mentors that you can't learn in a textbook. You can't learn from ChatGPT. You can't learn in school, right? It's just knowledge. It's just real life knowledge, right? And so, YMM gives me that opportunity to mentor the fellows that are part of YMM. So I'm not more so involved with the schools, like the boots on the ground. I'm more involved on the fellowship side. And so really just being a resource for them. Some of the newer fellows, not understanding that, hey, you want to be a doctor or nurse. Did you know that working for a large healthcare system, there's all this red tape, there's all these things you have to do. Like, those are things that I think people don't think about. But in the role that I am, I kind of have a high level overview of how a health system operates, which I think is beneficial for any person going into the healthcare field to understand how that dynamic works.
Nice. So I guess, I know you do through YMM, they have multiple events that they have. Could you maybe speak to like some of those and maybe talk a little bit about which one, like, do you feel like has been like the most impactful to you as an individual as you kind of done this work in this area?
Yeah, I'm glad you said that about the events, because I wanted to somehow tie that in. But so when Hillcrest first decided to host their youth summit 5 years ago or something like that, it was a partnership. So Dr. McNeil really helped me out, because I'm not clinical, and so he really helped me out on that side, and you as well too. So, but that kind of served as the model to have other summits throughout the year. So YMM is up to having 4 summits a year. And they're no easy task. It's a pretty heavy lift, but I think, oh gosh, I can't even count. I've probably been involved with 10 summits maybe or so. I think there's 2 that really stand out. One we just had 2 weeks ago in Tahlequah. So it was the first one that was done in Tahlequah, and it was at the OSU Cherokee Nation building out there. And it was a smaller summit. It was about 60 kids, but nevertheless, YMM is now in Tahlequah. And we had students from Muskogee, Tahlequah, Keys, and so really just kind of expanding our footprint. But what stood out to me about that summit was things that kind of just happened by accident that were amazing things. So we're kind of going through our event, and I think it was the second chief walks in, and Kelly Parsley, who's one of our fellows, she went up to him and was talking to him and kind of showed him around the summit, and you could just see the lights in his eyes kind of gleaming, right? He was just so thrilled, and he said, "Do you want me to say a few words to the students?" And we're like, "Yes, that would be awesome." So he addressed the students, and so that was I think a special thing that we didn't even plan for. And then towards the end of the event, there's another gentleman that walks in, and I was like, "Oh, it kind of looks important. Let me go up to him and ask him who he is." And he said, "Oh, I'm the CEO of Northeastern Health System in Tahlequah." And I'm like, "Oh, why are you here?" And he's like, "Someone told me to come check this out." And so I took him into the main room, and the students were listening to Dr. McNeil kind of give some remarks and stuff. And he's like, "Do you want me to say a few words?" And I'm like, "Yes." So these students were treated to not only hearing from the second chief, but also a CEO of a health system. And so it was just so heartwarming to hear, to just see that happen without even planning it. So
Awesome.
Oh, and then, sorry, one more thing. We have our Hillcrest Youth Summit coming up on Tuesday, March 10th, which is just in a couple days. So we have 200 students attending that. We host that at Tulsa Tech Health Sciences Center. And then YMM is also hosting its first annual fundraiser gala at the University of Tulsa.
Yeah.
So please go to the website and buy your tickets, sponsor a table. We're excited to just kind of share all the things that we've accomplished over the last few years.
All right. I was just about to kind of ask you about the gala. And so I know we don't have much time left. But for our listeners, whether we're talking about high school students or whether we're talking about, college students already in the throes of just, pursuing a career in healthcare and doing all the academic coursework, all that stuff that kind of goes in there, clinical rotations, whatever it looks like. And again, high school students who may I don't know if I want to do this or not, or some of them that are doing potentially doing some, volunteerism, things like that. What would be some just words of wisdom that you would just share with some of those students?
So I would tell them to explore things as early as possible. So what that's going to do is help them decide, okay, I really don't like that and I thought I would, or I really like that and I can't believe I do, so let me pursue that more. So, and whatever that looks like, it could be, someone comes to your class and does a presentation and maybe you connect with what they're saying. Ask them for their business card, send them an email, stay in touch with them. Adults want to help, right? We want to see the next generation succeed. And so I feel like if students can just not be afraid to put themselves out there and shake a hand, exchange an email, exchange a phone number, ask them, find something. You can find anything on the internet nowadays, right? So,
yeah.
If a student is interested in oil and gas, look up the oil and gas companies, send an email to someone and see what kind of response you get. But shadowing is another great way to figure out, do I really like this or do I not? Taking advantage of the opportunities that your school has. Just really not being afraid to put yourself out there is what I would tell the younger generation.
Very nice. Very nice. Well, Carolina, thanks so much for joining us today.
Yeah, thanks for having me.
Yeah. So if you haven't already done so, please like us on Instagram and like this podcast. So continue to follow us. We're available Spotify, Instagram, and also on our YouTube channel at 918 Stretched. Thanks for joining us.
Don't forget to give us a like and follow us on Spotify and subscribe to our YouTube channel to see more episodes of our podcast.